The World Health Organization has declared the Mpox outbreak a global health emergency. This is the second time we have made this declaration. The situation in Africa is particularly worrisome. A deadlier strain of the virus is spreading there. This strain is called Clade Ib. It's spreading quickly in the Democratic Republic of Congo and nearby countries. This declaration is a serious warning. It tells the world that we need to work together to stop this outbreak. We need to be better at tracking the virus. We need better ways to test for it. And we need to do more research to understand it.
The WHO is working hard. They are trying to get vaccines to the places that need them. They're also trying to get more money to help fight the outbreak. The WHO says everyone needs to act fast. We need to work together to stop Mpox from spreading further. Mpox, once called monkeypox, is a disease caused by a virus. It usually affects animals, but it can spread to humans. It's related to the smallpox virus, but Mpox is usually not as serious. Mpox is most common in Central and West Africa. It's often found in areas near tropical rainforests. Mpox spreads through close contact. You can get it from infected animals or people. Animal bites or scratches can spread the virus. Contact with an infected person's bodily fluids can also spread it. Even touching things that have been contaminated, like bedding or clothes, can spread Mpox. Symptoms usually appear 1 to 3 weeks after exposure. It often starts like the flu. You might have a fever, headache, muscle aches, and feel tired. A rash usually shows up a few days later. It often starts on the face and then spreads. The rash turns into blisters filled with fluid. These blisters eventually scab over and fall off.
The Mpox situation in Africa is very concerning. A more deadly strain of the virus is circulating there. This year alone, over 17,000 cases and 500 deaths have been reported. These cases are spread across 13 African countries. The Democratic Republic of Congo is the epicenter, meaning the outbreak is worse there.
Experts believe the true number of cases is much higher. Many places don't have enough tests. They don't have enough resources to track the virus effectively. This makes it difficult to know the true extent of the outbreak.
The Africa CDC has declared this outbreak an emergency. They are very concerned about the situation, especially for children. Children are among the most vulnerable. The lack of good health care in many affected areas makes the situation even worse. It's much harder to stop the virus from spreading without enough doctors, nurses, and hospitals.
Section 4. A worsening situation. Reasons for concern. The Mpox outbreak is raising alarms for several reasons. Firstly, the emergence of this new, deadlier strain is a major concern. This new strain appears to be more transmissible and causes more severe illness. This increases the risk of outbreaks becoming larger and more difficult to control. Secondly, the lack of resources in many affected areas is a huge problem. Without enough funding, healthcare workers, and medical supplies, it's incredibly difficult to track and treat Mpox cases. This lack of resources makes it easier for the virus to spread unchecked. Thirdly, there's a worry that the world isn't doing enough to help. While some countries have pledged aid, the response has been slow and insufficient. A global health emergency requires a global response, and right now the world is falling short.
Section 5. The global response, efforts and shortcomings. The international community is responding to the Mpox outbreak, but more needs to be done. Canada and the United States have promised to help, but their efforts are not enough. The WEU is calling for a stronger, more unified response. They are asking all countries to come together and contribute to fighting this virus. One of the biggest problems is the lack of vaccines. The Africa CDC has requested 10 million doses, but they have only received a small fraction of that number. This shortage shows how unfair the global health system can be. Richer countries often have access to more resources, while poorer countries struggle to get what they need. Another worry is that Mpox could spread beyond Africa. Right now, the outbreak is mostly contained to the African continent. However, Mpox can spread through close contact and contaminated objects. This means it could easily spread to other parts of the world if we don't take it seriously.
Section 6. Prevention and vaccination key to containment. Preventing the spread of Mpox requires a multi-pronged approach. Educating people about the disease is crucial. Public health campaigns teach symptoms and spread of Mpox. This empowers people to protect themselves. Avoiding contact with infected animals is crucial. Rodents and primates are known carriers. Practicing good hygiene is essential. Wash hands thoroughly with soap and water. Isolating infected individuals prevents spread. Vaccination is a critical tool. Smallpox vaccine offers some protection. It's about 85% effective.